My name is Amit Kochar. I am a facial plastic and reconstructive surgeon and director of the Facial Nerve Disorders program at the Pacific Neuroscience Institute. Facial plastic and reconstructive surgery is an extremely diverse field, and that's why I was drawn to it. In any given day, I may participate in a head and neck cancer reconstruction. I may also perform pediatric ear reconstruction. One of the luxuries I have with my specific skill set is that I'm board certified in head and neck surgery, otolaryngology, in addition to facial plastic and reconstructive surgery. So we treat patients with speech and swallow defects, patients who have issues with smell, taste, breathing disturbances. In addition to that, we also take care of the functional aspects related to facial plastic surgery. Another large aspect of my practice is the management of facial paralysis. At Pacific Neuroscience Institute, we have the Facial Nerve Disorders program, which was created specifically for this. We're able to help patients who have acute paralysis, sometimes from Bell's palsy, sometimes from a tumor removal or trauma, and we also can manage patients who have chronic paralysis. Healthcare is a very complex world. Patients have a very hard time navigating doctor's appointments, and I know that when they come to the Pacific Neuroscience Institute, it's different. The patient really can just focus on healing and getting better, and I can focus on helping them achieve that goal.